dogs like having their chin scratched, and just scratching his chin, we noticed the lump right at the top of his esophagus. First thing that we had to do was a lot of diagnostic tests.
When we're evaluating patients that come into the oncology service, there are a number of tests that are fairly routine.
As part of Triton's preliminary workup, chest x-rays are taken to help determine if the cancer has spread to his internal organs. Dr. McEntee also orders an ultrasound for Triton. Triton's neck tumor is examined to help the doctors determine the tumor's full size and the extent of surrounding tissue involvement. The doctors also examine Triton's abdominal organs, looking for evidence of possible metastasis or spread. Fortunately, the imaging studies show no evidence that the tumor in his neck has spread to internal organs. However, it does show that the tumor is large and extends around his larynx. This means that Triton's cancer cannot be surgically removed. During Triton's preliminary workup, blood is also drawn and sent to the lab for testing.
We will typically do complete blood work, a complete blood cell count, a chemistry panel, a urine analysis. Regardless of what tumor they may have, we want to be able to assess their overall health status.
The next step in Triton's testing is a CT scan. For the CT scan, Triton is anesthetized and moved to the CT room. Anesthesia is required to make sure that veterinary patients do not move during their scans. Triton is placed on top of a cushion that is conformed to the shape of his body. This cushion will be reused during his radiation treatments and ensures that he will be in the same exact position as he is during his scan today. A variety of monitors are hooked up and used to ensure that Triton does well under anesthesia. Laser lights are used to align Triton for his CT scan. The results of the scan come up on a nearby computer, where Dr. McEntee and her team evaluate the size and location of the tumor. Triton is then prepared for a surgical biopsy of his tumor to help his doctors determine what type of cancer he has. Surgeons remove a piece of the tumor, which is placed in a jar and sent to the lab for testing. In the lab, a pathologist examines the tissue under a microscope. The characteristics of the cells allow the doctor to make a definitive diagnosis of thyroid carcinoma. With all this information in hand, Dr. McEntee is now able to discuss Triton's treatment options with his family.
With Triton's tumor specifically, because it was invading and involving the larynx, there was not a good surgical option for him. So then we turned to radiation therapy.
My husband and I were both in agreement to treat him. My daughter, I have a 17-year-old daughter, he is her dog. She was afraid. She was very, very afraid because she just thought that the treatments were going to be worse than the disease itself.
I think with Triton, because of where his tumor was, even addressing that, reducing it some in size, that he was actually feeling a little bit better because of the local effect of the radiation on his tumor. And that's something we certainly see, that some patients that are uncomfortable because of their tumor will actually feel better at the end of radiation therapy, despite the fact that they may have some radiation side effects.
To prepare for Triton's radiation treatment, Dr. McEntee creates a computerized three-dimensional treatment plan. Using the results of his previous CT scan, she is able to visualize the tumor in 3 dimensions. The tumor and surrounding tissues are outlined to mark their boundaries. Multiple radiation beams are set up so that Triton's tumor will be irradiated from several different angles. Great care is taken to develop the radiation treatment plan to ensure that a safe but effective radiation dose is delivered to the tumor while minimizing the radiation dose to surrounding normal tissues. This information is transferred to the computer radiation machine, which will precisely deliver the radiation dose to Triton. On the day of Triton's treatment, He is anesthetized, so he doesn't move during his treatment, and he is lifted onto the radiation table. He is positioned on his custom cushion so that his body is in the same position each treatment. Lights are used to ensure precise positioning of the radiation beams prior to treatment. Once the machine and the patient are in place, everyone leaves the room for the treatment. But closed-circuit television and anesthesia monitors ensure that Triton is closely supervised throughout his treatment. The treatment takes only a few minutes, and Triton wakes up a short time later under the close watch of technicians.
When we're treating with a definitive course of radiation therapy, such as what Triton went through, it's daily, and he received a total of 16 treatments.
There are side effects associated with radiation therapy. These can vary depending on the area of the body being irradiated.
He did develop some local radiation reaction in his skin that we could see, and that was starting towards the end of his treatment. By a month after the end of his radiation therapy, that was resolving. Triton actually sailed through radiation therapy quite beautifully and tolerated the treatments to the point that he actually looked forward to coming in for his day-to-day treatments. And he stayed with us oftentimes during the week, would be home for the weekends, and then come back and be with us during the days, Monday through Friday, when we were treating him.
My husband and I were just saying that the last week, as a matter of fact, he's been acting like a puppy again, like he did when we first got him, very spunky, very playful. He definitely is feeling better. At 8 years old, he actually has probably another 5 to 7 years to live, so hopefully there'll be 5 to 7 healthy years with his treatment.